My name is Dr. Paul Iwe, consultant pediatrician, South Shore Children's Hospital.
My name is Moyo Kujenyo. I work as a nurse and quality assurance officer at South Shore Children's Hospital. So the World Health Organization recommends that women should start breastfeeding almost immediately after birth, preferably between the first 30 minutes and 1 hour after delivery, but as soon as possible. Basically, we expect that once a woman has delivered and she's comfortable enough, she has been cleaned up and all that, she should put her baby to breast so that she can establish lactation.
How long should a mother breastfeed? The mother should breastfeed. Our recommendation is 2 years or more of breastfeeding. First 6 months exclusive. The first 6 months just only breast milk, no water. But after 6 months, breastfeed with complementary feeds. So we encourage you to continue to breastfeed longer, as much as you can, 2 years or more, and a lot of benefits for the mother and for the baby. Many mothers don't realize the importance of breastfeeding to them. Prolonged breastfeeding helps to protect them from a lot of things, type 2 diabetes, breast cancer, the longer you breastfeed. But primarily, the focus of breastfeeding as a pediatrician is for the health of the baby, and the protections it gives the baby.
What is exclusive breastfeeding? Exclusive breastfeeding basically means that you are feeding your baby with breast milk alone and nothing else. Nothing includes water, so it means you're not giving the child anything apart from breast milk. And typically we recommend that this is done for the first 6 months of life before you can introduce other things after the child is more than 6 months old. So it's very important that you do this for the first 6 months, because the breast milk contains all the nutrients that the baby needs at that point and contains the protein that the baby can digest at that age. So you don't want to give the baby something that the baby cannot digest properly and cause problems for the baby. So, and all the nutrients that the baby needs at that age or between the first 6 months of life are embedded in the breast milk. So the child does not need any other extra things. So exclusive breastfeeding, in a nutshell, just means that you're giving breast milk alone, nothing else.
When do you commence complementary feeds? Okay, complementary feeds are feeds you add to a child after 6 months. The child has been on breastfeeding, solids, and home feeds, any other thing you give in addition to breast milk. Yes, adult food, cereals, and all that after 6 months. Now, those feeds after 6 months are important because at that time, breast milk alone is not enough to provide growth and development of the child. So we commence it at 6 months. Breastfeeding is important for babies because it's the appropriate food for them in terms of its combination of nutrients for the baby's growth and optimal development, and it's also food at the appropriate temperature for the baby. And also breastfeeding itself, the act of breastfeeding by the mother, also helps the child, helps mother-child bonding. It's very important. And there are also many other benefits in terms of protection of the baby from infections. A lot of antibodies in breast milk, especially the colostrum, the first one that comes out, the first part of the breast milk that comes out is very rich in antibodies that help to protect the child from infections. And then long term, it also helps children who are breastfed more also have less incidence of allergies. And then also we know that IQ of babies fed with breast milk are also higher than those that had less amounts of breast milk in their system. So a lot of benefits from breast milk. Anyway, many of them we've still not found out many benefits from breast milk. We're still finding out more benefits from breast milk, but a lot more than what I've said here. So we always encourage mothers to breastfeed their babies. Generally speaking, we encourage mothers to breastfeed. The more you breastfeed, the more you're likely to lactate more. So the more you put your baby to breast, the more the milk will flow. So the best stimulant for milk letdown, for the milk to flow, is the baby breastfeeding. So we don't want interruption in that, because that also will affect lactation. The other things to encourage mothers when they are lactating is to increase the amount of fluids they take with diet, increase the content of fluid in their diet, more fluids, more water, and then lots of fruits and vegetables in their diet. All that usually help them to produce more milk.
Okay, one very basic thing that mothers should know is that it's important they breastfeed on demand. So as often as your baby wants to feed, please feed your baby. So breastfeed on demand. Another important thing is that when you want to breastfeed, you need to be comfortable yourself so the whole breastfeeding process will not be too stressful for you. So find a comfortable chair, sit, relax your back, and then you're putting the baby to breast. You're not putting your breast to the baby. So if you need to use pillows to support yourself, maybe to place under your arm while you're holding the baby, you can do all of that so that you are putting the baby to breast, and then you can be in that position for a while and breastfeed adequately.
General breastfeeding advice to mothers is we want mothers to breastfeed and breastfeed for long periods of time. We want you to do exclusive breastfeeding as much as is possible, and want you to start breastfeeding immediately you deliver your baby as much as is possible. So the earlier you start producing good quantities of milk, and the better the bond between your baby. And so we encourage you to start breastfeeding and do exclusive first 6 months as much as is possible. Despite what I've said about lactation, if you still have problems with it, you should see your doctor, your lactation consultant, or you see us at South Shore Women and Children Hospital.
South Shore TV.